All right, so there's a huge safety concern with BBLs. Can you address that?
Yeah, so Brazilian butt lifts, aka BBLs, really got a bad rap and still do actually among a lot of plastic surgeons. And it's because a lot of mortalities that happen around the world from people that were doing BBLs because they were injecting fat into the muscle. When Brazilian butt lifts first came out, people were trying to inject as much fat as they could into the bum, but really there was no logic or ideas about where they need to inject it. So they were injecting it everywhere. And eventually it was making its way into the muscle because there was tears from the liposuction cannula or whatever cannula they were using to inject the fat into the muscle, and that was getting into the blood vessels, and then people were getting that into their lungs and they would die. Now with the advent of high resolution ultrasound, more safety measures being taken place, the American Society of Plastic Surgery has been amazing. Same with the Aesthetic Society and studying BBLs, doing cadaver studies. We now know how to use high resolution ultrasound. We know where to place it above the muscle. We know how to place it. We're doing that through static injections with just expansion that happens without moving the cannulas. Using larger cannulas to prevent accidental penetration into the muscle. Those are all things that are improving the safety. And I would say at this point, if you're getting to see a surgeon who does all of those things, the mortality rate is low. So overall, when BBLs are done appropriately and safely with the use of ultrasound, it is an absolutely fantastic procedure that can give someone a really great result. The morbidity or mortality from it is very, very low. And I think it gets a bad rap from plastic surgeons who really don't understand it, nor do they want to perform it.